Rise of Basic Men. My name is Chris, and as always, I'm joined by David and Joey. Today is a special day. We have a special guest with us here, Natalie. She is a forensic nurse. We're going to go into the mental side, what she does. Really going to have a great conversation today. First and foremost, thank you so much, Natalie, for coming on.
Hi, thank you for having me.
Right on. Well, let's just kind of jump into it, and you know, Natalie, tell us a little bit about yourself. You know where you're from. You know how you grew up. Tell us a little about yourself.
Yeah, I am actually David's sister-in-law, and have been. He's great. I have been in Austin since 2002, so about over 20 years.
Yeah.
Before that, my family moved around a little bit. I have a twin sister also, who's David's wife. And I live in South Austin. I have a beautiful husband and son. And that's about it.
Okay.
Nice.
Background.
Nice. So you're family with David then?
Yeah.
Again, I'm sorry.
It's unfortunate for her. But.
No, to see David, I'll be just,
Don't make me cry.
kind of warm and fuzzy. To see David and Maria's relationship flourish from over a decade ago, and how far we've grown to know each other and be friends is amazing.
That's
Yeah,
awesome.
it's been a good time.
Yeah.
Especially
I
now
wasn't
that
so sure at first.
Yeah, especially now that you have a pool.
Yeah.
I don't have to have it.
That's always a positive.
Yeah.
Well, Natalie, if you don't mind, let's just jump right into it here. So you're a forensic nurse. That's what really caught our attention, with you. And we've always talked and heard some things from you throughout the years. And we felt that it would be very educational for people to understand that there are these people like yourself out there who offer certain resources to help them in these kind of dark times, right, in their life.
Yeah. So
can you explain to people exactly what a forensic nurse does and how it differs from maybe, other nursing specialties?
Yeah. A forensic nurse is basically an experienced nurse with special training to talk to survivors of sexual assault in the immediate aftermath. And we have special training to talk about medical care options, safety options, and special training to do what's called a forensic exam. That's pretty much the gist of it.
Okay. And what got you to become interested in this?
Really I kind of just stumbled across it, to be honest. I was working at a hospital for a couple years, and I was looking to just grow and expand a little bit. I came across the job posting. It intrigued me. And so for a little while, I had my full-time job at the hospital, but worked PRN, which in the nursing world is very part-time, one shift a week-ish. I worked on call as a forensic nurse, and so did both of those things for a little while.
And PRN, is that pediatrics?
PRN is full-time, part-time PRN. PRN is as needed, and so it's those kind of healthcare workers that might work a shift or two out of the month kind of thing, rather than a full part-time commitment. It's common in the nursing world because of, I guess because of how short-staffed everyone is all the time.
Sure.
And so it's helpful to have people that can pick up extra shifts as needed. And so that's kind of how I landed there. And then I loved it so much. I found that when I was at work at the hospital, it felt like clocking in and clocking out, kind of a cog in the wheel, sort of. Mm-hmm. Not to downplay the work that hospital nurses do. It's very important, and everybody kind of finds their own niche, and I felt like that niche for me was maybe forensic nursing because of somewhat of the independence. You're not necessarily clocking in and out of a shift. You're kind of managing holistically somebody's care throughout your whole shift, and you're working with somebody one-on-one most often.
Sure.
And I loved that.
Do you find that it's slower in term, like, is it not as, I'm just thinking nurse, I just imagine them
Yeah.
like going nonstop for 12 hours straight, right? Is this more methodical and like more surgical, if you would?
It depends. I wouldn't say surgical. I would say it's more of like a balance, like to speak to like nursing as a science and an art, which is one of the nursing theories.
Yeah.
It's more like that, where you're really having to pull from life experiences, work experiences, and a lot of different things to kind of make decisions quickly. And kind of circling back to what you said, it's interesting because you think of a nursing shift at a hospital clocking in and out. It's like, you know, you're working that entire 12 hours. And yeah, that's true. In most hospital shifts, yeah, you are. But what I found with when I did my PRN work at you know, at that role, it was like time did not exist. Like it was a blink of an eye, and you know, it would be 6 hours later. Whereas time felt a lot slower at the hospital job.
Really?
Because I think it felt to me more like just working through the protocols and not necessarily taking the time to figure out what's important to that patient, which is the nature of hospital nursing. You're coming in for an emergency, you know, you don't always have time to just take a step back and be like, oh, what's your priority? You know, but in this role, we can, and I love that because everything's optional and you can kind of help address whatever's most important to that person.
So when you say optional, like you get to choose who you're working with and the areas?
So a forensic exam for most people, for adults, there's different kind of limitations I can get into. It's optional. You know, you get to decide if you want to undergo the forensic exam process. So even if you've involved the police already or somebody's called the police on your behalf without really letting you know that that's an option too as an adult, they kind of lost my train of thought there. What was the question?
Yeah, so, you know, when it comes to, you said options, right?
Mm-hmm.
Like,
right.
is the victim
Yeah, you were
or
telling us
the
about
client or the patient?
And we use the word survivor. That's kind
Survivor,
of,
okay,
yeah.
okay.
And because and I'll interchange that with patient because they are my patient.
Sure.
But survivor is the preferred nomenclature because, yeah, you survive that and you're alive, you know, and victim kind of what I think we've learned as a profession it's not a good term. It's not empowering.
Yeah, no, I'm with you.
And so the forensic exam, as far as like the evidence collection process, and I can get into all the steps of that, it's considered an elective procedure in the medical world, which is something you get to choose to do. It's not a life-saving measure. It's an option.
Sure.
Okay.
Now, can you go into maybe like, not necessarily like any details, right, of, you know, we kind of understand why, you know, anyone or survivor would be there, right? But can you explain the timing of when this happens? Is it immediately after, you know, this happens with somebody, or is it usually over time that someone makes their way to you?
So with adults, we work with survivors in the 120 days after an incident has happened. We can offer medical care options up to 10 days after, but as far as evidence collection, and again, I can get into all the like details, the step-by-step, that would happen within 120 hours or 5 days of the incident. Most people don't come in right away. Most people, it's been at least a day or two, because oftentimes people don't realize what's happened to them right away. It might take a couple days to process what's happened. Not only that, but a traumatic event can really impair how we process information, and it really affects our short-term memory. And so that can really come into play. Something that I've heard is that law enforcement, if they're involved in like a shooting, they're given 2 sleep cycles. And that's just what I've heard. I don't know if that's a fact. before they are offered an interview or before they're like
Evaluated?
questioned or whatever. And that's because that can help kind of bring things down a little bit. You know, it can give you time to process your experience or memories, and it can kind of give you time to come back down from that fight or flight mode. So yeah, oftentimes it's been a couple days, and that might be better for somebody's well-being sometimes, is not just like, let's just go through the motion. Sometimes some of the questions that we can go through during this exam can be harmful to your mental well-being. It's not an easy process. So
Yeah. Curious. You know, I didn't really know too much about this more recently until I started reading up on it. But for everyone else out there, are these survivors contacting you directly? Do they make their way into the hospital and then they share your contact information with them and then they reach out? Do the doctors or nurses set this up for them?
yeah,
How does it work?
there's a few different ways, and I can speak to my experience with, you know, places I've worked, but it would vary from like county to county or city to city. Most often there's a hotline that people can call and get in contact with, like a local rape crisis center, and they would connect them with advocates, sexual assault advocates, whose their role is advocating. They have higher levels of confidentiality. They're not writing things down. And people have a legal right to have someone called an advocate after experiencing assault to help break down their options. So sometimes we'll get calls from a hotline. And in that scenario, they may or may not have involved law enforcement at that point. We don't necessarily know if they want to do an exam. You know, we're getting information from our hotline and reaching back out to that person and just having a conversation with them as a starting point to see how we can help best.
Okay.
Other times we're dispatched by a hospital or law enforcement. So we might be dispatched by a detective or like a victim services representative that says to us, you know, we're working with a survivor. They've just reported. We've given some information about a forensic exam, and they're interested. You know, we'd like to set up an appointment. So that's kind of how things go normally. Then when they land in our clinic, it's a conversation again. It's not just like, okay, here we go. It's a thorough breakdown of the options and explanations of our roles, because it's important for that survivor to have complete control over what happens from there, because we're looking at long-term health, health kind of sequelae here. We're not just looking at how this is going to play out in a criminal justice system, because that may or may not happen. It may or may not be helpful. But what we do know is traumatic experiences lend to, I don't know if you guys have heard of like the ACE study.
Yeah.
That's adverse childhood experiences, but that can play into long-term health consequences as an adult, such as like, anything you can think of. I don't know, Joey, do you have any?
Not top of my head, no, but I know exactly kind of where you're going with it.
There's mental health, there's physical health consequences that really play into how this person can kind of move on from this experience.
Yeah.
Does that make sense?
Yeah,
for sure.
absolutely.
Curious though, you mentioned who else is involved here? So you, the nurse, is there a psychologist, or something like who's in this team of yours? Like what type of titles?
Yeah. So the forensic nurse operates independently, but as I mentioned before, every patient has the option, every survivor has an option to speak to or have a advocate present during the, explanation of options and during the forensic exam process. So we, from that standpoint, would be a nurse and an advocate, because for most people during an exam, they're, a nurse and an advocate are working hand in hand to help address this patient's needs, because a nurse is a nurse. You have to have focus on medical care and safety, where an advocate can their role is extremely important because they are the ones focusing on resources, on kind of cueing into some of the things that maybe a nurse might not, as far as like anything really, because of kind of all the tasks that we might have on hand. And they can also help advocate on behalf of the patient. If they're observing a nurse is like, hey, let's do this swab, and maybe full consent's not being kind of, obtained, those kinds of things, it's another person there to ensure the patient's needs are being met and that their legal rights are kind of being...
Like nobody's overstepping their bounds.
Exactly.
How do you navigate that? Because I feel like you, based on your experience, you kind of understand the importance of doing one thing. Like, hey, we need to get you to do this, right? This is kind of like what you feel is the most important for, let's say, the survivor. And if, let's say, they don't want to do anything, is there a part in your role where you kind of have to try and educate them to understand the importance of agreeing and going down a certain path or a certain test or talking to somebody?
My only obligation would be to fully explain somebody's options and ensuring that they understand what it might mean if they refuse or, if they decline or accept.
Sure.
I have no agenda of my own. I don't work with the police. I don't work with, I don't work for the police.
So people that come in, right, and your role to advocate on the importance of going down a specific direction, whether that be a psychologist or this physical test to understand data, just in case they want to go down a legal route or something, I don't know, right, is where do you stand in terms of hopefully influencing them to do right things that they might not know are the right things?
I guess it would be my priority would be to remove my own bias.
Sure.
And remove what I think is important to them, because personally, I think it's most important to, and as a professional, it's most important to make sure that they know the medical care side of things, HIV prevention. There's a 72-hour timeline if there was a potential exposure. That's a scary topic, and most people are at really, really low risk. But sure. If I'm interacting with somebody and within that acute aftermath, that's my most important role, is explaining to them things that have time frames. Okay. And the evidence collection, that I have no control over where that's going to go. So I just explain that as an option, just like anything else. I can't assume that that's going to help them move on from this process more quickly than somebody might, else might. I think it's just making sure that we can help them identify what their priority is and what's going to be most helpful for them as a person.
Sure.
Yeah, give them all the options before they make the decision, right? Everything that they need to learn, everything they can about what their options are before they can make an educated decision what they want to move forward with, right?
Exactly.
Well, I guess that kind of bleeds into another question, because I feel like the most important thing for your role is to make them feel safe, right? So how do you ensure that these survivors feel safe, heard or respected when they come to the clinics or that location?
Yeah. There's a lot we can do to help survivors feel safe, and we utilize what we call trauma-informed care, which is giving someone care with the understanding that they may have experienced, or we know that they've experienced something that can be traumatic. And that trauma-informed care can come into play in all types of settings. But here, most importantly, because these survivors are likely in a state of fight or flight mode, they may not feel safe no matter what I offer. And I can't necessarily take that personally if they lash out at me or don't feel safe.
Sure.
But there's a lot that we do. We setting wise, kind of soft lighting, comfortable surroundings, non-threatening sort of body language. This isn't our clinic. If it's a hospital, you may not be in control of some of those factors,
Yeah.
but you can be in control of your own presence and kind of being aware of that, because people after an assault are, like I mentioned, fight or flight mode. They have a heightened sense of intuition, potentially,
Sure.
and are more aware of what might not feel safe. So if you're coming in there as a nurse not feeling fully confident, then they're going to be aware, and it's going to make them feel uncomfortable too. So
You just come in there and you're like, I got this. I got you.
well, it comes with time. Yeah, I think it's just that in my experience doing this, I've realized that your presence is the most important thing that you can bring to that person, and your response is one of the most important things that you can kind of control as a healthcare professional, as a law enforcement person, as a friend. How you're coming in and treating that person with respect and the level of control and safety you're offering them after something like this has happened is so, so important. And so, like, as nurses, you know, just respecting their autonomy, respecting who they are as a person and what's important to them. You know, I would say as like law enforcement, doing their best to just ensure that they're not treated like an inconvenience when they're making a report. Because talking to somebody and making that phone call is so hard for somebody who has experienced something like this, you know, experienced an assault in the first place. And then when they're met with some like resistance or something that kind of like reinforces that societal, you know, concept that the victim blaming, that is so harmful.
I bet. I mean, I don't think any of us can really try to understand exactly what anyone is feeling in those moments. And for you guys to go that extra mile to put the survivor first, and it's not even just how they're being treated, it's the environment that they're in, like the lights being dim. Do you guys wear scrubs, or is it kind of normal, formal, you know?
I think most forensic nurses would just potentially wear scrubs or something else professional with closed-toe shoes.
Gotcha.
I typically wear scrub bottoms and like a t-shirt because I feel like it's a little bit less threatening maybe. Also, it's more comfortable for me. And I think something that is important to speak to is medical coercion and just the concept of a nurse or healthcare professional being present as their role and like, you know, what they're wearing, who they are. That can come with a lot of pressure to maybe do something that person may or may not feel comfortable with. So coming in from that perspective and being very forthcoming with that person about, hey, I don't work for the police. I basically work for you to kind of explain your options and let you know what's available to you.
Sure. Do survivors typically work with? Do they want to work with cops or law enforcement, or is it kind of they feel scared and, you know, they don't want to go that far? Is it, I want to take care of myself, but they're kind of hesitant to work with law enforcement?
It's so different. There's a lot of reasons why someone wouldn't want to report to the police right away, but may still want an evidence collection exam, and we can do that. It's called a non-report. You can have almost all the same evidence collection options and have it be stored for up to 5 years in Texas.
Really?
Yeah, and so you would have that evidence collection kit, which we call it, stored there at Texas DPS. And within that 5 years, if you choose to report to the police, they can pull that evidence and utilize it for the investigation. At the end of 5 years, it's destroyed. And those kind of statutes and like timeframes change with each legislature, but that's kind of what's going on right now. The non-report, since I've been doing this work, has been available. And yeah, I mean, it's hard to know what. Yeah, so sorry, kind of circling back. People might not want to report to the police for a few reasons. You know, safety might be one of them. Maybe this is a partner. maybe it's a domestic violence situation. Maybe making that police report could put that survivor more at risk for harm, because the police can only do so much, you know? Yeah, you can make that report, but you don't know if they're going to get arrested right away. You don't know what kind of access they're going to have to you. Maybe the police take the report and then leave, and then you're there with that perpetrator. Also, just fear, you know, or really sometimes just practically, some people may not be able to process kind of all the decisions that go into this, but no, I want to maybe have evidence collection exam, and I might want to report to the police later on down the line. But I can't necessarily navigate all those things right here and now. That would be a reason someone might do that non-report.
Yeah, that makes sense.
Yeah.
Cool. Well, can you kind of discuss maybe the importance of informed consent in your work then? Especially,
Yes.
you know, when dealing with trauma survivors then?
Absolutely. That is our top priority, is informed consent. I may have mentioned already, this is kind of like considered an elective procedure or something that, you know, you can choose to do for most people. And we're coming from a place of, this is what we have to offer you, not like, hey, this is what we're going to do next. And we also understand that survivors are especially kind of vulnerable in this state. And so it's our duty as nurses to make sure that they fully understand their options, that they're not, you know, under the influence of any substances, because that's very important, that they're, you know, more or less sober when they're making decisions about these types of things.
Do you find that most people coming in are sober, or is it kind of half and half, or it just happens sometimes?
If there's any inkling that this person is under the influence and not able to make decisions for themselves, then we're just a soft landing place and like scheduling follow-up. You know, how can we end this now and make sure your safety needs are met? But we're not going to provide medical care.
Legally, you can't take it much further, but you can make sure to reschedule or make sure they have the
absolutely.
resources. Gotcha.
Yeah, because there is that 5-day time frame.
Yeah.
And so sometimes, it's like you get someone and they're falling asleep, and that's not consent either. If you're so tired that you're falling asleep while you're filling out paperwork, that doesn't make me feel like you're in a place to make decisions for yourself, you know?
Sure. Well, what do you do in those moments? Like someone's falling asleep, maybe it's, you know, obviously they're a survivor, right? Who knows what they've been through. You guys are still, I guess, sensitive to what's going on. Do you provide an area where do you house them to gather some sleep? Can you do that?
There are a lot of, you know, community-based clinics and rape crisis centers work closely with domestic violence shelters. So there's that, you know, there's the role of the forensic nurse isn't necessarily to like be a, you know, housing situation, but the advocate that we work with has a lot of knowledge. Most advocates have a lot of knowledge about resources in the area. So yeah, you can still help somebody there. And also just kind of setting expectations and boundaries, you know, because that's where sort of some of the you know, science and the art comes into play of nursing, where you want to respect their autonomy. And like, yeah, somebody who's experienced something traumatic might be falling asleep, but they can still consent. So just kind of working through that with the patient and, you know, setting boundaries and saying, hey, you know, if you're falling asleep, then this might not be the best time for this. And gauging your kind of assessment from there. It's hard to explain.
Yeah, well, I think you explained it pretty well.
Yeah, pretty well explained for sure.
Because, you don't want to, like, turn somebody away just because they're falling asleep. But as a nurse, you have to, like, assure that they're in a place, especially not ever having met that person before, hopefully, and not really knowing, like, their baseline of how are you on a normal basis, you know? Yeah.
Well, from your experience, what do you feel to people out there would be the benefit of choosing to go down this path and contact people like yourself? Like, obviously people are hesitant, they feel in danger sometimes, you never know the scenario, right? But for anyone out there, what do you think would be, what would you tell them in terms of the positive or the benefits of contacting someone like yourself as soon as possible?
I think it would kind of like a knowledge is power situation. I can't say that I don't know everybody's lives and priorities and experiences, so I can't say that like making a phone call to a nurse is going to like for sure be helpful to somebody or benefit them. But what I will say is that they can share information.
Is there a time when a scenario like this happens to somebody and they need to, let me try to phrase it. Yeah.
Okay, so there are some things that are like medical care timelines. Like for pregnancy prevention, you have 5 days. And so it would be, it could be helpful for someone to talk about that with somebody, or prevention for the most common sexually transmitted infections, resources. I think the benefit is that in most situations, that person is not obligated to do anything. And I say in most situations because if somebody is calling us, like let's say our hotline, and they're a minor, so like under the age of 18, they're an elderly person, if they're disabled, then that would have to be reported to the police.
Sure.
But they would still be in control of if they did the evidence collection exam or not. But, we have those mandatory reporting guidelines as healthcare professionals, and that comes into play too with reporting abuse. But in most situations, it's kind of like, hey, here are your options. There's no pressure. Do you want to make an appointment? You can't, So that, I think that would be a benefit in just knowing what's out there and what's available.
Yeah, so the main deal here is making sure that your mental health is in good hands, that we can at least hopefully get you to a safe area,
Yeah.
right? Or get in touch with people who can help you, right? But the whole purpose is to make sure that you're safe and sound and we're protecting you at all costs.
Yeah, and that also speaks to like some people who've experienced abuse or an assault might have thoughts of harming themselves or killing themselves afterwards. And so if there's any chance that we can kind of circumvent that or like at least offer resources or be somewhere for someone to call or talk to, then that could be a benefit too, Mm-hmm. Yeah. And it's totally normal to feel things like that after like a traumatic experience,
Yeah, for sure. All right, well, let's kind of take a step back here real quick. So, what I'm really curious to know, and I'm sure our listeners are, what is the actual process of somebody as they come to you, right? So they come into your clinic, you've already gone through all their options and everything like that, and they're like, okay, what's the next step, right? Can you kind of walk us through, kind of beginning to end, what a person would go through in that sense? Whatever you can tell us.
Yeah. And I think the options is kind of the first step. Like, yeah, maybe we've established some sort of important information over the phone if I've had the opportunity to talk to them before. But really, expectations for people in general when they would kind of arrive to a clinic or arrive to a place where they would be able to speak with a nurse and an advocate. It would start by asking them to take a seat, is there anything we can do to make you feel more comfortable? Is something off?
No,
you're good.
Bo is whining in the background.
Our mascot's groaning over there, so but go ahead and continue on.
Yeah, so they would arrive in the clinic and offer kind of comfort measures, like, is the temperature okay? Hey, we're about to, explain our roles and kind of throw a lot of information at you. Can we help make you feel more comfortable before then? And then we'll go into the explanation of our roles and their options. As a nurse, my priority is their health and their safety, and explaining everything that's an option to them. You know, I don't work for the police. I work for them more or less to guide them through their options and let them pick and choose what they do and don't want to do, you know, what they are or not comfortable with. And that can include medical care, so preventative antibiotics, pregnancy prevention, referrals for, you know, mental health or therapy or, you know, HIV prevention. And then the bulk of like my interaction with the patient is going through a list of questions, medical questions, questions about things they've done after the incident and before coming in to our clinic, before meeting with them, such as like eating, drinking, you know, brushing your teeth, things that can affect the evidence, but are just things that we document. So we can still go through the whole exam, which I'll get into if somebody's done all the things multiple times, you know, showered, all those things, as long as it's within that 5-day time frame. We also ask about consensual sexual contact that they've had in the last 5 days, in case any of the evidence that we can offer to collect comes up with somebody else's DNA. And then after that, we can go through a full statement of what happened to them. I can record, type out word for word every detail of the incident, kind of start to finish, for medical care purposes, to know where on their body we might offer to collect DNA evidence with a swab, or basically a Q-tip that can pick up DNA from the skin that someone has left behind, and where on their body to look or further assess for injury, which is most important. You know, if they maybe say something about the incident where they completely lost consciousness, if there was pressure applied to their neck, where they were, you know, strangled, is what we consider that. Those are important details that can come up during that history portion taking that we can help further address with medical care, because, you know, that's our priority. And then we can even go through more detailed, like yes or no short answer type questions about the incident to know what kind of DNA might be found on some of the swabs. Because DNA from somebody's hands is different from DNA from somebody's mouth or saliva. And so we go through those kind of like more detailed questions for that reason. We go through questions about safety, you know, what their relationship with this person that did this to them was. Some people don't remember anything at all. You know, like maybe they wake up after they've been drinking and they hurt. Then that could be a reason why someone might suspect an assault. And we can still do a high quality forensic exam and offer the same kind of medical care that we would if someone doesn't remember anything, that we would with like a full history.
Yeah.
And this is kind of a sidebar, but oftentimes people don't remember everything in like a linear fashion because of the neurobiology of trauma, because when we're faced with a threat, our brains go into fight or flight, freeze or fawn mode, and we go into survival mode more or less.
What's fawn?
Yeah, I was gonna say, can you elaborate more? I mean, I've only heard fight or flight, so there's 2 extra ones.
Yeah, and I educate my patients on this a lot because I feel like it brings a lot of reassurance and like awareness, because fight or flight is what you think of when our sympathetic nervous system kicks on, fight or flight. There's also freeze and fawn. Freeze is where you literally just can't move your body. There's a phenomenon, I can't think of the name right now, but maybe we'll circle back to it, where your body just freezes literally and you can't move. It happens to soldiers at war. It happens to people who are faced with a threat like this, and they just can't move their body. That's the freeze response. And then the fawn response is like, hey, what can I do to get myself out of here safe, I mean, these are all methods, freeze and fawn are all methods to get yourself out of a situation safely. But fawn is like, hey, can I do this? Can I do that? You know, what can I do to like get out of here and be safe after this? And so some survivors might experience feeling of guilt if they maybe like did certain things that they were being forced or asked to do. But really what's happening is your brain, your survival brain is kicking in and you're making decisions based on what is going to get you out of here alive.
Sure.
Gotcha.
Yeah. That's the gist of the freeze and fawn responses. And then
Akinesia? Does that?
No, it's like what is it? It's like
This is-
parasympathetic or
Yeah, this is akinesia is a symptom that causes a person
it's
to lose
not
the
it.
ability
It's
to move.
paranomic.
Yeah. Well, yeah, it's probably one of those survival instincts where your body just loses the ability to move in general. You just kind of like,
You just kind of lock up.
yeah, you just
Yeah.
go, yeah.
Everything shuts down all at once.
I'm looking it up.
I mean, you see that in you brought up people in war. I mean, you see that in movies and stuff like that. You know, bombs going off everywhere and people are just like stuck in that,
Just frozen.
and frozen in that one spot. Yeah.
Yeah. I'm sure there's some medical.
I know what it's called, but I can't
Camouflage
think of it.
response.
It's all good.
Fine.
It's all good.
But it's basically like playing dead.
Right.
Gotcha.
And that it's something I hear people say, like, you know, I'm so confused because, like, you know, I thought I would like fight. I thought I would, you know, fight back, but like I just couldn't move. And that can be really scary, but that's a normal kind of process that's a normal way that our bodies deal with threatening situations.
Gotcha. So, what kind of comes next in the
Yeah.
process there?
So after we go through like the whole questions, you know, all the details of the incident, which people can choose to answer or not answer, you know, that's important as an option for people to know that they don't have to respond and have it be written down.
Mm-hmm.
They can decline to answer something if they don't want to.
Do you feel people are like really willing to explain, you know, what's happened to them, or do you see a lot where they're kind
It
of like
depends.
hesitant?
No, I think most people are forthcoming with that information, but I think it's so important also to know, for them to know why we're asking this kind of thing, and where it's going to go. You know, like I'm documenting this. It could go to law enforcement if you've involved them or if you even choose to involve them in the future. And also if they're declining to answer something that might be important for me to know how to guide their medical care, then I might say, you know, hey, this question could be helpful for us to know in order to recommend X, Y, and Z. They have a right to know that, you know? And so if it's something they're not answering and I feel like, hey, this might be important information for me to know as a nurse, then I'll explain that rationale and the why behind the reason, you know, the why behind what I'm asking.
Yeah.
So they can choose to answer it or not.
Gotcha.
Knowing the issue with law enforcement or the stigma, right? And, you know, you definitely don't want people to come in and feel like you're what's wrong, right?
Exactly.
How does the involvement with law enforcement typically work with survivors, you know, who choose to report their assault? And do you guys work with the same law enforcement people? Like if you like them, you know?
That's not really up to us because we work with law enforcement. We're not affiliated, I guess, or we don't work for law enforcement. And so we collaborate in survivor patient care. But oftentimes, you know, what kind of something I have to dispel to a lot of survivors when they come to us is, you know, we're here, we can collect the evidence and package it all up, but we're not a laboratory. We don't process and, you know, we don't process the swabs or anything. And we're not in control of what happens with it afterwards. You know, I'll tell you like everything I'm writing down, everything that I'm collecting is going to get packaged up and it would go to the police to help them with their investigation. But oftentimes I don't really know what happens to it from there. I've testified once in my 5 years of doing this work, pretty much full time, almost the whole time. And so these things, and I'm not saying like trial is like the end all be all, and maybe some of these things get pled out, or maybe justice is brought to that survivor in another way. But from my experience of the criminal justice system, I've done this 5 years, and I've testified once. So for me, that brings awareness, and just like, I'm going to focus on what's important to this patient here and now, and what's going to help them, whether make sure their body's okay, whether it be explaining things more, whether it be feeling just validated, whatever it is they need. It's important for us to meet them where they're at, because the criminal justice system may or may not be the way that they seek justice from this.
Right.
So that might be, I don't know if you could speak on this, because you said, you've done it once in the whole 5 years, but is there any challenges that come to mind, that survivors face when navigating the legal system with an assault, or can you speak on that?
Yeah, there's a lot. There's, first of all, time. Yeah, so I would say there's a lot of challenges survivors face. One being like cost and time off work, potentially. Yeah, we can write them a work excuse, but we don't know that individual's situation. If they're paid hourly, they might not get paid time off.
Sure.
So, yeah, I can write them a work note, but it has to come down to what that individual's kind of like up against. There's the time that they have to spend during the exam. The average exam can take 3 to 5 hours.
Oh, wow.
With the patient there. And then that's not including the time that we spend kind of before and after preparing and kind of wrapping things up afterwards to help minimize that time that survivor's there with us. There's emotional and mental effort. It's not easy to make a call, then have to make an appointment, and then come in and then navigate all these barriers. Like, maybe they don't have a ride. We can help with that. But there's a lot of things beneath the surface that, happen, that go into this person even reaching out to us. And then having to feel obligated to kind of go through the history, the details of what happened. Responses from professionals can be like overwhelmingly negative, I think. And like I mentioned, like having everything that goes into making a call or making an appointment somewhere, and then having like being met with like, oh, you're an inconvenience for even being here. That's a barrier. I just, I'm in admiration of everyone that walks in our door because of a lot of reasons, but I recently have had some back issues going on. I've had to go to a clinic and get an x-ray and an MRI, and I've just been in a lot of pain. It's getting better now, but like this was last month. So I went into this clinic and I'm like tearing up. I'm in so much pain, and these and I'm in healthcare, I'm a nurse. And these healthcare professionals are throwing all this paperwork at me, questions, and then they're like, okay, this is what we're going to do. And I'm like, okay, MRI, like what? Like, when do I get that? Where, like, what does this cost? And it's just like, it's exhausting.
It is.
And that's for me, a healthcare professional. And I kind of relate being in pain to same as fight or flight, because those same kind of like things are kicking in your brain. And like being in pain and being in that clinic, I was literally like dissociating. I was like, it was a really humbling experience for a lot of reasons, but also just put into perspective. This terrible thing has happened to somebody, and then they're coming in. We've got a stack of paperwork for them to go through to undergo this exam. They're having to navigate all these options. They've got the burden of truth if they're involving the burden of proof. If they're involving the police, it's just a lot,
Sure.
and a lot of information to process, a lot of decisions to make when you're literally in a state where you're just like, your brain has pumped all its mental energy into something, and you're now kind of in the aftermath, the aftershock, and it's
you kind of get turned off. Like, if it's not a smooth process of getting what you want done, and professionals like yourself being able to help in a white glove experience, right? I feel that you kind of naturally just go, okay, yeah, I'm done. No matter the circumstance,
and I
you'll be like,
wouldn't
this
blame
isn't
them.
worth it.
And some people come in and they're like, yeah, no, this isn't for me. And it's like, okay, I'm so glad that you came here, but I'm also so glad that you felt comfortable enough to say no to something that you're not comfortable with.
Sure.
Right.
I meant to ask this earlier, but I'm sure there's people out there that something happens, probably in their eyes, it's not worth going in. It wasn't like that. From your definition, what is sexual assault? Like what on the littlest scale to the largest scale, like who needs to come in,
Well, nobody needs to come in and that's just like how I've reframed, like we use conditional languages like, hey, it's not like, hey, this is what we're going to do next, which is nursing language. It's like, hey, this is an option for you. If you're comfortable, we can do this, and here's why. So that first there's that. And then the question was kind of people coming in. What was that?
Yeah. So what's your definition of sexual assault? So people know that no matter what this circumstance is, this is an option for you. Because some people something might happen and they go, no, it's fine. Like it doesn't call for that, right? They might think that this is going too far, but in reality they need to. So from your eyes, maybe what defines sexual assault?
So it's hard for me to even get there because I feel like there's several like layers to that. Like there's what our society does to like minimize and invalidate unwanted sexual experiences for us to even be at a place where we're questioning ourselves is shit.
Yeah.
That's not good. And then in terms of the law, any unwanted touch, it's hard. It's outside of my level of expertise to like determine, what's going to be prosecuted, what's going to be charged.
Sure.
But any contact to sexual organs, any penetration, and penetration in the law is beyond, like any contact to like the vulva area. So any penetration that's beyond the outer labia, that's penetration. It doesn't necessarily need to be internal, vaginal. Any groping, that's against the law. Any pressure that's placed on the neck that makes it difficult to breathe, anything that would qualify the criteria of strangulation is even a higher level of offense.
Sure.
And then there's also other factors like coercion, like restraint. Restraint can be alcohol, any other substances. If you take any illegal substances or, ingest that doesn't like disqualify an assault from happening, if that makes sense. So
Sure.
You can go out and be drunk and dancing on a table naked, and you are not asking to be sexually assaulted. You're not asking for someone to take advantage of that situation.
Yeah. So for anybody out there, you're having a good time, you're drinking, maybe you take some extra,
extracurriculars.
Yeah, extracurriculars.
Yeah.
And even though if something did happen, you're not to blame based on what you put in your own body.
Absolutely not.
So if something did happen, or you recollect that something might have happened, you're unsure, it's still an option out there to go visit a place where you work at.
Yes.
To even go through the stages to understand, maybe uncover, does this qualify, and what resources are out there to help you.
Absolutely.
I love that.
Yeah.
I love that.
And I that's not even something that like until you kind of presented that to me. Yeah, it is. That is an option for somebody.
Because I feel like a lot of people out there are like, no, I'm good, or they just kind of ignore it, and this wasn't like that. This happened plenty of times. It's whatever, or they feel at fault.
Yeah,
or 100%.
Yeah, like maybe they're going to get in trouble for doing what they had done.
Yeah,
even though they still didn't ask for that to happen to them.
Yeah.
So it's okay to to use these resources. There's people like you out there, and so don't feel like you're at fault.
Yeah, and I want to just kind of touch on a distinction that when we do these exams, our nurses are collecting the evidence. You know, we're identifying injuries, we're documenting them, but our role is not investigating. It's not saying like, oh, you know, this is what might have caused this injury. It's literally just documenting it, gathering, packaging, passing to the police. Because I think a lot of people come in and they're like, I don't know what happened, or I want to know that there's proof that something happened before I move forward, which makes a lot of sense, but that's not how it works, sadly. You know, someone can't come in and get a non-report and have it tested and then decide to move forward with the police. It's like they have to decide to move forward with the police before any of that evidence is going to be like processed.
Yeah, before they do any testing or
Yeah.
anything.
Focus more on you right now, and thank you so much for running through these steps and kind of uncovering and painting a picture for everyone else for this process. But for you yourself in this role, how do you ensure that your own mental well-being is intact or avoid burnout in such a demanding profession?
I think just an awareness and a support from your colleagues are like kind of the two most important things. So like awareness meaning like, what is it going to take for me to be able to like manage myself and like bring in an energy to this person that's like acceptable. And support from your colleagues. I'm very blessed and fortunate to have my team. I feel like I could reach out to any of them and say, hey, I'm really feeling it this week. I've maybe only seen a patient or two, but like they were difficult exams and like I am just kind of at my bandwidth and I would be supported and like, taken off shift. That's a beautiful thing. It's a privilege, 100%, to have that. But I think in my experience, it's like pinnacle to being able to like to sustainability in this type of role is letting go of your own kind of like because in nursing and in a lot of careers in America, it's like you're praised and rewarded for like overextending yourself more or less. Mm-hmm. But I think what I've realized as I've gotten older and have like other kind of life situations is that you really have to keep yourself in check and figure out what it is that your formula, I guess, to like not get, not boil over, not bubble over.
Exactly. And that kind of leads into my question is what do you do to make sure that you're good to go on any given day? Like I run.
Yes.
What kind of things do you do?
I do run. I love running. I'm more of like a mental health run, I think, because like I'll only go like a mile or two and it's not even a full run the whole time, but it's like I feel great afterwards and I know that. And with my back and stuff, it's been challenging because it's like, they're like, yeah, you probably shouldn't run until we kind of get this figured out a little bit more. But I've convinced them to let me do, or I've, shared that I'm just doing kind of a light jog and they're fine with that, the doctors that I'm working with. But there's that. And then there's also, come to find out, I need like a lot more solitude and silence than I realize, and to kind of keep me centered, especially with having a kid,
A
2-year-old. Yeah. The amount of like just time that you don't have, the amount of just uninterrupted time.
Yeah, kind of time to yourself to sit down and just...
And whether that be mental too, because sometimes it's like, you're sitting by yourself, but you're like, oh my God, like I need to blah. But I'm realizing I need time to center myself and have a clear head several times a day. That really helps me. Meditating.
I was just about to ask if
Yeah.
you do meditating, because before we started this podcast, you had us do a breathing exercise.
I did, I know.
Yeah.
And that's something like through my work at where I work, I've learned a lot about myself. I've learned a lot about a lot of things. And what that has brought to me is, like an awareness of energy, an awareness of capacity. Yeah.
Kind of recenters you.
Yeah.
It worked for us, man. Felt good after that.
Yeah.
No, I do that all the time. I do
And the
6
more
in,
you-
6 out.
Yeah. The more you do it, like the less I've heard, the more you do it, the less time you kind of need to like kind of bring it back in. You know what I mean?
Yeah, it does something with your neurochemistry. Podcast I listened to talked about how it can bring your heart rate down like 10% in 30 seconds or something real quick.
Wow.
And then like if you're like, I work with a lot of patients who have experienced panic attacks, and something like this, like the kind of exams, that the settings, everything can really be conducive to that. So
Yeah.
if somebody discloses they've had a panic attack, or if I'm sensing things, I try to like connect with that person at that time and say, hey, if you're feeling like things are kind of building up, if you need to take a break, let's do that, because, you know, this is hard. And then also asking them like, hey, you know, what is helpful for you if you've had a panic attack? You know, is it physical contact? Is it like grounding, kind of guided meditations? You know, is it more directive kind of, because everybody's different when it comes to their like anxiety, and like some people it might be really grounding to like have someone kind of like touch their arm, or like, hey, like let's go walk outside, where others need to kind of just be like by themselves for a minute, you know?
Sure.
Absolutely.
What do you think one of the first steps a survivor should consider, you know, taking after an assault? Like, you know, they haven't spoke to you guys yet. Is there anything that you tell them that would help people in these situations to know kind of what to do themselves?
It's so hard because my role is like to be non-biased and to support somebody else in their decisions, as long as it's, you know, I'm giving them the medical and safety information that they need to know. So it's a hard question to answer from there. It's
Sure.
like, but I would say just making sure that you have someone or some people that you could reach out to if you're having dark thoughts or suicidal thoughts would be the priority. And then taking steps to ensure your physical safety at that moment, and making sure, you know, like medical stuff could be
Like you
addressed.
get away if it's a danger to you or anyone else around you. Make sure you get out. Make sure you have a support system, so friends or family.
Yeah.
How do you think friends or family could best support a survivor? You know, is it just being open and an ear and, you know, offering anything to them at the time?
I would say that goes a long way, because what is hard for some people, or what's really difficult for some survivors after an assault, is like answering a bunch of questions. I mean, nobody wants that to begin with. And then especially if they're being met with questions from like a medical forensic nurse or like law enforcement, removing the pressure of having to answer questions, I think could be really helpful for a loved one, you know, in support. And just being a non-judgmental ear, you know, like just an example, like you are snowboarding down a mountain and you break your arm, and then it's like protruding out of your arm, and you see the first nurse that you see is like, oh my God, that's horrible. Like, holy shit. Like what? You know, that's not helpful. So if there's something that you're hearing from a friend that you're like, oh my God, like I got to do something, just try your best to listen. You know what I mean? And try not to pry, try not to ask too many questions. Just try to be supportive and refrain yourself from like asking too many questions. That would be, I think, my only.
Kind of like inserting yourself into
Yeah, just ask what you can do to help, rather than trying to gather information for your own information, or like maybe you want to like, who did this? Like I want to go like find them. No, just.
So anyone out there who wants to be a support system to somebody that might be coming to them is, you know, be sensitive to the other person's needs. You know, don't ask like, why'd you do this type of questions, you know, just be able to listen and be an ear and just be there for them.
Yeah. I mean, and realizing that like even coming to someone and like explaining what has happened is like really hard. So being that person for somebody is an honor. as a friend or like support person, and just yeah.
Yeah, I find it unreal the amount of people that I know in my life that have been strong enough to open up about their experiences. This happens more than you know out there, and there's plenty of people that don't talk about it, right? And I feel there is that stigma of being able to, if they mention something, then they feel weak, or they feel it was their fault, or just judgment in general. Which prevents people from opening up, and ultimately I feel like it hinders their mental health long term.
Yeah.
By there's things that pop up in their lives, and it reminds them of this, and that could be one of the reasons why someone or close to you might be down a bad path.
Yeah.
And I feel that what you do today, people like you, is a beautiful thing. It's the doors opening towards something amazing in our kind of community or our world, where it's okay to talk about things.
Yeah, and it's like all we're doing is opening the door. The real work is what those survivors are doing, like coming in and like speaking about what happened to them. Like they're the ones that are doing the work in this.
Sure.
And I hate that. I hate that there's so much that they have to do. So anything we can do to support them is, okay, I guess.
Yeah. What do you think that communities in general can do to better support survivors, and work towards hopefully not hopefully preventing these sexual assaults? Is there anything that maybe companies or communities or anybody can do? Is it just talking about it and hopefully having resources?
Yeah, because when I hear like preventing sexual assault, I think like that comes in the hands of like educating perpetrators, but that's kind of outside of what I know.
Sure.
But that's what comes to mind is like, let's educate perpetrators, or let's maybe do things to help support people who've experienced like intergenerational trauma or abuse. And a lot of people, I mean, some of these people who are abusing, maybe they've experienced abuse their entire upbringing, and that's what they see as normal.
Sure.
So there's so much that goes into that, and I want to say it's like, I hate to put it in the hands of like the survivors having to do something, which is not what you posed in your question, but communities, I would say, just more of an awareness around what's available to people, more funding for resources. I mean, more funding for the staff that does this kind of work. That's what I would say.
And even like you mentioned earlier, it's maybe even continuously putting a focus on making it easy to go through this. You don't have to fill out so much paperwork and, repeat yourself as often.
Yeah, almost like streamline it so it's not as hard for the survivors when they come in the door.
And it's like, I've been doing this a while, and a lot of the nurses that join teams or become forensic nurses haven't been doing this a while. For one, because it's hard. They might not get the same support that I'm getting at my workplace, and they burn out and they're done. So like maybe they're not getting to the point where they're gaining a level of experience where they can at least feel comfortable streamlining this for a survivor.
Yeah.
Just putting that out there too.
Sure.
Better training for nurses and yeah.
Okay. I will continue this, guys. No worries. All right, cool. Well, I guess more of a advice questions here for you. What advice would you give to someone considering a career in forensic nursing?
I would say do it not for like, if you're like, oh, I love like science and like forensics and, law enforcement, this may not be what you expected, because there's not as much like, it's not evidence or law enforcement driven, it's nursing driven, just like any other healthcare professional. And I would say put yourself first if this is something that you feel like you can do sustainably. Some nurses start the training and something bubbles up maybe, and they're like, oh, wow, like, I don't think I can do this, And that's okay. Like being self-aware, you know, if it's not something for you, then don't push that, you know?
Sure.
Putting yourself first and realizing what it is that's going to help this be sustainable for you, because we put a lot of focus on our patients and being trauma informed. But if you're not in a place where you can really wholeheartedly like care for people in these kinds of situations, then you're doing a disservice, you know?
Sure.
So it's like, yeah, I don't know.
Yeah.
So, I mean, in this line of work, is there anything you recommend to some of these survivors, especially ones that are having a tough time, maybe dealing with paperwork or accepting that this is something that's happening?
It's hard again, because it's like I can't, in my role, I'm not there to give advice. I'm just there to present options non-biasedly. And I would say just put the same answer.
Yeah.
Put themselves first. I hear
Yeah.
a lot of people that are like, I'm doing this because I don't want this to happen to somebody else.
Yeah.
And it's like, wow, you know, like that is incredible that they're doing that for that. But you don't have to, you know, like put yourself first. Like don't feel like you have to do something or anything else from here forward for somebody else.
Sure.
You know, what is it that's going to help you feel better after this? And what's going to help you heal? Maybe it's doing all the swabs and stuff. Maybe it's not.
All right, so Natalie, let's. I do have one last question. As far as our listeners listening, you know, to this whole discussion that we've had, what do you want them to get out of this? Like, what do you want them to take away from our discussion today?
I think I just want them to take information and knowledge, and just knowing that they have options that are under no obligation to actually do anything. So in most communities, they can call a hotline, they can speak with somebody more about their options, and that person is not or should not be pressuring this person to do anything. I know that was very vague, but
Yeah. It's fine.
they should be under no pressure to do anything that they don't want to. And after an assault like this, they've had a lot of their options taken away, a lot of their control taken away. And so our place is to give them those options back as they move through this whole thing, you know?
Absolutely.
Well, I just want to take a moment to express our deepest gratitude to Natalie for sharing her invaluable insights and expertise today. You know, the topics that we discussed are not only crucial, but deeply personal and sensitive for many out there. So to all our listeners, whether you're seeking understanding, healing, or ways to support, know that you're not alone and that there are professionals like Natalie who dedicate their lives to helping and healing. Okay, so thank you for joining us on this journey of understanding and compassion today. And until next time, keep rising, keep inspiring, and remember, your story matters.
Take it down!